Did you know that nearly half of all heart attacks might be silent, striking without the classic signs we've been taught to watch out for? That's right, no dramatic clutching of the chest or sudden collapse. Instead, these silent heart attacks whisper symptoms so mild that they're often ignored or mistaken for trivial health issues like indigestion or stress. Here's a shocking statistic. Research suggests that silent heart attacks constitute 45% of all heart attacks and significantly increase the risk of dying from heart disease. Imagine walking around, not knowing your heart has suffered damage, because you didn't recognize the signs. It's a stark reminder of the silent epidemic affecting millions worldwide, often with fatal consequences. But why are these signs so easily dismissed? Our bodies send us subtle signals, yet, in the hustle and bustle of daily life, we're quick to brush them off. The truth is, understanding and recognizing these silent signals can mean the difference between life and death. In this video, we're diving deep into the 10 signs of a silent heart attack that are always ignored. We'll unravel the mysteries of these silent signals, equipping you with the knowledge to listen to what your body is trying to tell you. From unexpected fatigue to discomfort that's easy to dismiss, we're here to shine a light on the crucial signs that are too important to ignore. Stay tuned as we embark on this life-saving journey, exploring each sign with the seriousness it deserves. Your heart might not always shout for attention, but its whispers are just as important. Let's learn how to listen. Chapter 1: Introduction to Silent Heart Attacks. Imagine this. One moment, you're feeling just fine, maybe a little tired or a bit of discomfort in your chest that you chalk up to indigestion. The next thing you know, your doctor is telling you that you've had a heart attack. Sounds shocking, right? But that's the reality of a silent heart attack. Silent heart attacks account for 45% of all heart attacks and often go unnoticed because their symptoms are mild and can be mistaken for less serious health issues. Unlike the dramatic portrayal of heart attacks we see in movies, these silent signals can be easily ignored, leading to devastating consequences. A silent heart attack, or medically termed as a silent myocardial infarction (SMI), lacks the intensity of classic heart attacks but is just as dangerous, carrying a risk of damage to the heart muscle. It's like a thief in the night, causing harm without a loud alarm. Here's a startling fact. Studies suggest that silent heart attacks are more common in women than men, challenging the stereotypical image of heart attack sufferers. Awareness and education about these silent signs are paramount because every moment counts when it comes to heart health. Chapter 2: Understanding Silent Heart Attacks. To truly grasp what silent heart attacks are, it's essential to understand how they occur. A heart attack, in general, happens when the flow of oxygen-rich blood to a section of the heart is blocked. With silent heart attacks, this blockage occurs without the classic symptoms of a heart attack, or the symptoms are so mild that they're not recognized as a heart problem. One reason these heart attacks go unnoticed is the human body's amazing ability to adapt to pain and discomfort. Many people who experience a silent heart attack mistake their symptoms for everyday ailments like the flu, indigestion, or just aging. According to the American Heart Association, these misinterpreted symptoms lead to a delay in seeking treatment, increasing the risk of further heart damage or even death. The notion that you could have a heart attack without realizing it might sound frightening, but knowledge is power. By learning the subtle signs and understanding that heart attacks are not one size fits all, you're taking a crucial step towards protecting your heart health. Remember, silent heart attacks might not make a lot of noise, but they carry a message that's loud and clear. It's time to pay attention to your heart. Chapter 3: Chest Discomfort, Not Always Painful. When we think of heart attacks, the first symptom that usually comes to mind is chest pain. However, with silent heart attacks, the signal might not be as blatant as a pain. It could be a slight discomfort, a sense of pressure, or even a mild ache that seems more annoying than alarming. This discomfort might not even be constant. It could come and go, leading many to ignore it as a temporary nuisance rather than a sign of something more sinister. What's fascinating is the body's way of signaling trouble. For some, this chest discomfort is described as feeling like an elephant is sitting on their chest, but for others, it could just feel like an unusual tightness. The variability in how this discomfort presents itself is a key reason silent heart attacks are overlooked. A study highlighted by the Harvard Medical School reveals that people often expect a heart attack to be dramatic and intense. When the reality doesn't match these expectations, the signs are dismissed as something minor, like muscle strain or indigestion. Chapter 4: Fatigue, More Than Just Tiredness. Fatigue can be a tricky symptom because it's something everyone experiences from time to time. However, when it comes to silent heart attacks, the fatigue described is not the usual tiredness after a long day at work or a poor night's sleep. This is an overwhelming, unusual fatigue that doesn't go away with rest. It's the kind of exhaustion that makes daily activities, which were once easy, feel incredibly challenging. Here's an interesting fact. According to the National Heart, Lung, and Blood Institute, fatigue as a symptom of a heart attack is more commonly reported by women. They might feel so tired that even walking to the bathroom feels like running a marathon. This gender difference in symptoms contributes to the complexity of diagnosing silent heart attacks, particularly in women who might attribute their tiredness to overwork, stress, or a sign of aging. Understanding that this profound level of fatigue is not normal is crucial. It's your body waving a red flag that something is not right within. Recognizing this can be a life-saving realization, prompting individuals to seek medical attention sooner rather than later. By acknowledging that fatigue, when accompanied by other subtle signs, might be more than just tiredness, you're taking an important step towards protecting your heart health. Chapter 5. Shortness of breath, the silent alarm. One might not immediately connect shortness of breath with heart issues, especially if they're not exerting themselves. Yet, this symptom can be a crucial warning sign of a silent heart attack. Imagine sitting comfortably in your living room, reading or watching TV, when suddenly you find yourself gasping for air, as if you've just sprinted a mile. This unexpected shortness of breath, without any reasonable cause, can be your body's way of signaling that your heart is struggling to pump effectively. This symptom is particularly insidious because it's easy to write off as nothing more than a sign of aging or a consequence of being out of shape. However, when your heart can't deliver enough oxygen-rich blood to meet your body's needs, shortness of breath can occur. The American College of Cardiology points out that this symptom is often accompanied by feelings of fatigue, further complicating the body's distress signals. Chapter 6. Indigestion or heartburn. Indigestion and heartburn are so common that many over-the-counter remedies are available to quickly ease the discomfort. However, what if the cause of your discomfort isn't something you ate, but rather a silent heart attack? Surprisingly, symptoms like indigestion, nausea, or heartburn can actually be manifestations of a cardiac issue. These gastrointestinal symptoms can easily be dismissed as the result of dietary choices or stress, but they may indicate something far more serious. It's a tricky situation because these symptoms genuinely overlap with those of many non-threatening conditions. Yet, the distinction comes in the context of these symptoms appearing suddenly and without a clear cause, especially if you haven't eaten anything that typically triggers indigestion. The Cleveland Clinic emphasizes the importance of noticing when these symptoms coincide with other signs like discomfort in the chest or shortness of breath, as they could point towards a heart-related issue. Chapter 7. Sweating and nausea. Sweating excessively or feeling nauseous might be easily attributed to a bad meal or a stressful day. However, these symptoms can also serve as silent alarms for a heart attack, particularly when they occur unexpectedly and without any apparent reason. It's a cold sweat, different from what you might experience on a hot day or after a workout. This type of sweating can feel more intense and out of place, as if your body is trying to cool down from an internal overheating you can't explain. Nausea, too, can be a deceptive sign. You might brush it off, thinking it's just a stomach bug or something you ate, but when it's linked to heart issues, it usually feels more severe and is accompanied by a sense of unease or discomfort that doesn't quite fit the typical food-related issue. The American Heart Association highlights that women, in particular, may experience these symptoms more frequently than men during a heart attack, further complicating the recognition and response to these subtle signals. Chapter 8. Pain in unexpected areas. Pain related to a heart attack doesn't always center on the chest. Sometimes, it can manifest in areas you wouldn't immediately associate with heart health, such as the jaw, back, or arms. This pain can range from a dull ache to a sharp, unexpected twinge, often catching individuals off guard. The pain might not even be constant, it could come and go, leading to further confusion and delay in seeking medical attention. What's particularly tricky about these symptoms is their ability to mimic other conditions. Jaw pain might be dismissed as a dental issue, back pain as a result of poor posture or lifting something heavy, and arm pain as a muscle strain. However, when these pains occur without a clear cause and are accompanied by other symptoms like shortness of breath or nausea, it's crucial to consider the heart as a potential source. According to Johns Hopkins Medicine, recognizing these atypical pain points can be a lifesaver, especially since they can be the only warning signs in some cases of a silent heart attack. Chapter 9. Feeling lightheaded or dizzy. Imagine standing up and suddenly feeling like the room is spinning or you might faint. This sensation, especially when accompanied by any of the previously mentioned symptoms, could be a warning of a silent heart attack. Dizziness or lightheadedness often occurs because your brain isn't receiving enough blood supply, a situation that can arise when your heart is not pumping blood effectively due to a blockage. This symptom is particularly deceptive because it can be easily attributed to dehydration, hunger, or even just standing up too quickly. However, when this feeling of lightheadedness is combined with other signs like chest discomfort or unusual fatigue, it's a signal that should not be ignored. The Mayo Clinic advises that sudden dizziness without a clear reason warrants medical attention, especially if it's out of the ordinary for your personal health experience. Chapter 10. The importance of prevention and early detection. Prevention is undeniably better than cure, especially when it comes to heart health. While understanding the silent signs of a heart attack is crucial, equally important is adopting a lifestyle that minimizes your risk factors for heart disease. This includes regular physical activity, maintaining a healthy diet, avoiding tobacco, managing stress, and keeping track of your heart health metrics like blood pressure, cholesterol levels, and body weight. Early detection plays a pivotal role in preventing severe outcomes from heart attacks, silent or otherwise. Regular checkups with your healthcare provider, being aware of your family history, and monitoring for any of the symptoms discussed can make a significant difference in your health journey. It's also vital to educate those around you about these signs, as heart disease remains a leading cause of death globally. Remember, the heart is the muscle that keeps us going, and its whispers can sometimes be the only warning before a crisis. By listening to your body, making informed health choices, and seeking medical advice when something feels off, you're taking significant steps toward heart health and longevity.